record this session or so that you can show it later to students that may not have participated. Again, my name is Isabel Herrera. I work for Region 1 Education Service Center, and today our topic will be nursing and critical care, I think. And it is for Cybermentoring for the PATHS Project. So I hope you enjoy it, and I will give it to Nurse Clarissa.
Hi, everybody. Good day. How are you? Sounds like we're sleepy. My name's Clarissa. I'm a general nursing educator here at Doctors Hospital at Renaissance, and I've been ever so blessed to participate in many different units. I've worked in pre-op, post-op, OR. I've done some women. I've also worked in ER. That's where I was born. So in the emergency room, I feel like if you do the ER, you pretty much can conquer everything. I also have worked in the medical floor, and that's also in the clinical division unit, which we call CDU and CDU2. I had the opportunity to be a clinical coordinator, so that really coordinates all the nurses that are on the floor. And then for some time, I played interim director. After that, I was able to do, I was a TAVR coordinator, which means I was a trans-aortic valve replacement nurse. That means we do open heart surgery, but we come through the carotid area or the inguinal area. So it was a blessing to work with 2 cardiologists and 2 cardiac surgeons to be able to proceed with those TAVR patients based on my assessment. So that was fun to participate before I got recruited to become an educator. My responsibilities here at DHR as one of the 3 general educators is to educate all those new nurses that are coming and graduating from school. Any nurse that has prior experience, any orientation process, they need to understand our procedures and our policies. So we do the RNs, the LVNs. We also take care of medical assistants. So if you're interested in that, certified nursing assistants, which are our little angels on the floor with our nurses. We also participate in nursing residency program, meaning we have classes for our nurses that are brand new nurses. We want to make sure that they do well, so we take them under our wings and kind of give them a 16-week education and orientation process. We also take care of some physician residents. We'll offer some classes for them. I am an American Heart instructor, so if any of you all have taken basic life support, that's BLS, we have an American Heart trainer here. We're a training center. So I teach BLS and PALS at this time. I also work as a TMCC Provider, which is a trauma nurse core curriculum, and also I'm an instructor. So when we have people who are in an accident, that's considered a trauma. Anything with bleeding, we are going for that trauma level 1 hospital. So that's very important for our employees to have. I also participate in a CPI, which is crisis intervention prevention. So, in the hospital field, we don't just deal with medical, we also deal with mental and verbal issues. People are scared, they're afraid, maybe, nobody wants to be in the hospital, you feel very vulnerable. So I teach nurses how to speak to people when they're in a crisis and how to recognize a crisis. We also take care of a lot of trauma fairs, so we can make sure that our nurses are very familiar with all the equipment that they're going to need in case of an emergency. I want you guys to understand that there's so many things that you can do with nursing. There's different areas, because you might say, well, I may not pay attention to this lecture because I really don't want to be a nurse, but we need you. See, if you're really good with computers and technology, we have a health stream coordinator that puts all our course curriculum together, and she is able to understand what it is that we need and how to deem our nurses competent, because we want to educate everyone on the same pace, on the same level. If one unit gets something, we want to make sure the other one gets it too, and that's the way we're able to just transcribe it. So just like you have in school, you have a transcript of all the classes you have taken, that is what the hospital does with our health stream coordinator. We also have nursing informatics. So if you are really good at computers and you understand the nursing field, we need you to help us document all the information so that we are able to bill that appropriately to the insurances, so that we're able to describe what it is that we actually did. So if you're good in computers, you like nursing just a little bit enough to understand it, we need your computer technology to develop these documenting systems, because when we're able to document a patient as they come in, I'm sure some of you have gone to the hospital for an outpatient procedure, or even when you go to the doctor's office, you have to fill out some paperwork. Well, what if I could tell you that someone there could just type it in as you go, and we have all the information we need, and so now we can take care of the physical, the medical aspect of that. So that is a nursing informatic type of position. There are different types of level of education here with the medical field. We start with our medical assistants, and you'll find plenty of them in your doctor's primary offices. They are assisting the physician in an outpatient experience. We also have the certified nursing assistants, and what they do, they are the right hand of the nurse, okay? So they tell the nurse, hey, I found this, or they help the patient ambulate, or they'll help the patient walk to the bathroom. Anything that the patient may need physically, they're able to assist. And I highly encourage you, if you are doing a CNA, or some of you all are CNAs, some of my CNAs are my best nurses. I have 2 CNAs that started with me, and now they're ICU nurses. I actually have another person who is an EVS lady. We call her environmental services. They're kind of the ones that clean up the rooms and make sure it's clean. She's now a nurse too, so it's not impossible. Okay, we also have LVNs. Those are a licensed vocational nurse. They're pretty much like RNs, but their scope of practice is just a little bit different because they work under the registered nurse to maintain the condition of a patient. Important skills, if you all are looking anything to do, and it doesn't matter if it's nursing or not, but if you're looking into doing nursing, one of the biggest things that you have to work on is an essay to get into college. Why should they give you a spot? And you can't say because you get good grades. You can't say because you're smart. You gotta put your experiences on what you have done to show that you are really interested in this field, because everyone else is going to have good grades, and everyone else is going to tell you that they really want to do it. So what separates you from everyone else? And it is that, what are you doing now about it? Well, I'm volunteering at the hospital. So I do, I feed babies at the nursery all the time during the summertime. So you're participating, you're actively participating in something that is related to that field. And that is what's going to separate you from all of the rest. What are you doing different to look different? How are you going to stick out from all of the applicants? The same thing with scholarships, right? When I was younger, I've always wanted to be a nurse. So this was always very important to me. So I was volunteering everywhere I could. And so when I applied for those scholarships, I remember applying for 25 scholarships, and I got 22. That's how I paid for school. So, and I went to St. Mary's University. I got a presidential scholarship, and I also was a prima ballerina for a long time, so I got a dance scholarship as well. But the main focus was for me to become a nurse, and I am currently a student, so I'll be an FNP soon, God willing. So it's important to develop those skills now. You don't want to find yourself going into a career because everyone else was doing it. You have to do what you want to do, right? My daddy always said, when you work at your job, if you love it, you'll never work a day in your life. And so you really have to think about what is it that you want to do, not go with the crowd, because you're all not going to get the same job, and you may not go to the same school, but you have to really put your feet in, go volunteer at a hospital, go do something related, or get your BLS card, or so to see if this is for you, because sometimes you have to experience it before you can really say, yes, that's what I want to do. Also, when you're learning, even in college, you're going to learn that you are not going to just memorize information, okay? Some of us, I remember when I was younger, I would go to history class and say, why do I need to learn about all these cultures? Where am I going to use this again? I'm never going to use it. And for me, it's a rude awakening now, because I'm dealing with patients that come from different cultural backgrounds, and we have to be very empathetic and sensitive on how it is that on their belief system, because that's going to make us a successful caretaker. So all of these courses that you're taking will apply to you in the future in some sort of fashion and any way. Also, if you speak Spanish, or if you don't, that is something that you really need to do, because that is the culture that we live in today. 90% of our population speaks Spanish. Right now, have you all heard of the baby boomers? We're getting ready for the baby boomers because they're retiring in the next 2 years. So we're going to have an influx of people to take care of, which is a wonderful thing. I hope they don't get sick, right? But there's going to be more of them than really of us. And so we have to think about that in the future. Everything that you learn in nursing school, everything that you learn in the medical field, you're going to have to not just know it, but you're going to have to apply the information. I know this information. How does it work for me, right? And my advice for you guys is, of course, you want to make sure that it conquer your weak areas. Find out what makes you most afraid. Why do you not want to do something? And when you seek advice, you need to seek it from people who have the same goals, the same perception that you do as well. You want to make sure, you research nursing programs. Where do you want to go? Anytime we have a patient or if you don't have a primary doctor, or maybe you need a knee surgery, what do people do? They go on Google and they start looking to see where they want to go. So you should be doing that for your colleges as well. Create a financial plan. Everything is possible. You're just thinking of reasons why not to do it. You never have time, okay? You never have money. Those things don't change, okay? All materialistics. If you lose your car, you can just buy another one. If you lose your house, you buy another one. But what you cannot get back is your time, okay? Do you all have any questions for me? Hello? Do you all have any questions for me? Is there anything that you guys want me to have or are curious about? Okay, so I'm getting a question here. How much education it really took? Really, to become a nurse, it just depends on what level you want to be. Do you want to be in an associate's level or in a BSN level? South Texas College is a very good college, and you can get your LVN or RN there within 2 years. They are currently in the process of making all their ADN, which is an associate degree plan, to get a BSN, which is 4 years. Okay, it is very important that sometimes it's what you do that helps you be successful, and not always just the grades. Okay, because you have to be able to perform. In nursing, part A would be to be able to pass the exams, yes, but part 2 would be that you would actually have more of a skills checkoff. See, sometimes we know things, but sometimes when you perform them, they're not actually accurate, okay? It's very important right now that you do have great grades, but just not that, guys. As I explained earlier, it's so important that you're actually involved in the career that you want to pursue, okay? It's not everybody can do nursing. You should be doing nursing because you love it. We have to be emotionally there for the patient. We have to be there to help them feel better. They're in a very vulnerable state. The kind of classes that you should take for nursing would definitely be your anatomy and physiology. I do recommend that you also take something like psychology to help you how to respond. That's one of the things that I do in my nonviolent crisis intervention. which is called CPI, is how do you respond to someone who is upset with you, right? So a lot of times when we receive people in the ER, we need to help the patient immediately. Family will follow through and they want to know what's going on and they want to be there, but we have to do our job. So part of us have to stay with the family and kind of be a support system. When they're anxious, we want to be supportive, right? To let them know that we're trying our very best. Always your experiences, there's nothing really that can help you with that, but just take it a day at a time. Also, it's so important that you think about taking your TEAs. I'm sure that's what it's called now. Also, they do a HESI test, so start preparing for that. How they accept certain people at a certain time, it just really depends on who applied with you. While you're in high school, you know, the classes that you can take, you know, I took a lot of science, a lot of physics classes, math classes, because you do have to do calculations for medications. You do have to dilute certain medications as well to give to the patient, because what I give an adult person, I can't give a child. Also, one of the best things that you can do as well is really practice interview skills, right? Even when you're a student, that you are going to come to student affairs to see if you can do some volunteer work. You know, it's really good for you to have practice some interview skills, even for a regular job that you would have even at school, because you do have work studies that can help you pay for your college also. And also, you know, being a social bird, you know, you want to make sure you gain customer service experience, because it makes you a better person and you can communicate your ideas to people a lot better. I want you guys to know that sometimes when I receive, I just thought of an example. You know, I have a nurse that really wanted to do ER, and she thought that's what she wanted to do, and then she felt at some point, you know, she was not cut out for it. And so I didn't want her to get discouraged, because she was a good nurse. Maybe that wasn't the right place for her. And now we've moved her to OR, and now she is a renal transplant nurse, and she's having fun and she's loving it. It's a completely different experience. So what I'm trying to say, guys, is that when sometimes your brain will tell you this is what I want to do, but when you actually do it, you have to think about, are you actually enjoying it? So everything is attainable. You just have to stick with it. If nursing was easy, everyone, you know, would be doing it. So I'm getting a question about a critical case and how I was able to handle it after. There have been many critical cases because I overlook behavioral as well. So there's critical issues there. But the one thing that I always rely on is communication. When you're able to communicate to your party, right? You know, it doesn't matter if you're a CNA, if you're a medical assistant, if you're a doctor, if you're a nurse. At the end of the day, our focus is the same and our goal is the same, to help the patient. So we want to make sure we have a patient level center of care. Most of the time, the critical is a big word to use, you know, but I use it from my experiences where sometimes, you know, we have to help the patient in a more dire situation where it's a life and death situation. I had a gentleman, and this one hits me really hard. He coded on me, which means he went under cardiac arrest 9 times. 9 times this man went into cardiac arrest, and to this day he lives. So for me, that is very rewarding. And I wasn't doing it for anyone else, but for him, because when I take care of patients, this person could be my mom, this could be my dad, this could be my sister, my cousin, an uncle, an aunt, my grandparent. And so I put my heart into it. And so we want to make sure that we do our very best, guys. You know, I train my nurses to do the best that they can do. I don't want a nurse that is coming in late or just does things halfway, because remember, these are the people that are going to take care of us. And so for me, that gentleman was very critical. You know, I got rushed through the ER, through the elevator, doing compressions on this man, getting him to the ICU, getting him hooked up. And I tried everything I could, and it takes a lot out of you. We have to check on each other, on us nurses, right? And I cried, and they said, you know, Clarissa, you did the best that you could, and he's alive because you did. And guys, you know, sometimes you win some, sometimes you lose some. But to know that I did the very best, that's all I can do. I go home every day and I said, what did I do great today? What can I improve on? And what am I going to change to make this better? And I do that, guys, because I need to be able to sleep at night. It is very hard to know, if I had done this, would that have changed that result? If I had done that, would that have been better? So that is one of the most critical cases that I've had to deal with. But in my regard, he did live, and I was very excited. It could have gone the other way, but I was very blessed that everything was where it needed to be at the right time. I also have been a rapid response nurse, and you know, in the team where down the hall, we call this code blue. I'm gonna say code blue again, and that means that the heart is under cardiac arrest. Time is brain. We have to, the patient no longer has a pump. We have to be the pump. And so when you do BLS, you are the first responder. All you're doing is you now are that pump for that patient. And I remember that day that down the hall, they had pushed that code blue button. So the team is running to that person to help them. And then 30 seconds later, my patient that I was with a few seconds ago coded. So now I'm by myself with my CNA. So this is why we're very hard on our training. You know, you go to school, you learn what you're supposed to learn, but when you get into the real world, you can't just be task orientated. You have to apply the knowledge. You learned all this from school, but now that you know the information, how is it going to help you to make those better choices? And every day as a nurse, you are looked at to see what is a risk of doing something versus a risk of doing nothing, and which one weighs more. So part of that is you really have to critically think, be fast-paced. And so this is where sometimes we have to cultivate our new nurses, because if you were a brand new at your job and someone is asking you, it could be at any job, somebody's asking you to do something and you really haven't been oriented to the place, it can be kind of intimidating. So, you know, we want to make sure that we cultivate a culture where we're training and training over and over again every year, because the things will change. And we believe that, you know, we are how do I want to say this? We are as strong as our weakest link. Let me see here. There's a pop-up on my screen. I'm not sure how to take care of it. Can you all see me? I don't know, my computer's doing something funny. Okay. All right. So, great. Great, guys, bear with me. My screen went black all of a sudden. I was like, ooh, where'd they go? Okay, so I just got a great question, and I almost want to laugh when I see it, not because I'm trying to make fun or anything, but the question is, being a nurse, will it help your chances of going to med school? You can go to med school from the ground up, or you could be a nurse and then decide, do I want to go to med school? Do you have better chances? Yes, you do, because guess who I educate? My physician residents. And guess what? In 4 years, they become our doctors, right? DHR has started the physician residency program. So a lot with that, I get the pleasure of doing teachbacks for them for American Heart. So sometimes we also have classes for them in the summer. And guys, whether they're doctors or not, we all work together. So, you know, they'll help me do things and we help them do things too. Will it help you? You just will have a keen insight of what it takes to be in the medical field. Believe it or not, we've had here in the hospital where someone had no hospital experience at all. They started as a unit clerk. And then from a unit clerk, they went back to school and became a CNA. And then they did CNA work for a while. And then we finally got them to get into nursing school. And so now they're nurses. And so now we have those nurses that are pursuing FNP just like me, which is a family nurse practitioner. So yeah, it's growing, it's big. Do you have chances? Absolutely, because you kind of already know what to expect. You already know what the scene looks like. You know what to do and what not to do. So it makes it easier for you to kind of blend in. Can anyone that didn't have nursing experience go to med school? Absolutely, but it's your grades that will get you there. When you go to school, guys, it's about school, and you get what you put in, okay? Nobody's going to be chasing you to do your homework. Nobody's going to be chasing you to attend class. I remember when I went to St. Mary's University, when I met with my counselor, and they told me, I want you to remember, Clarissa, it costs $66 per hour every time you miss class. So if your class is a 2-hour class, you just threw 100 and what's the math? Let's see here. $132 to $34 in the trash. So for every hour you're gone out of class, you just threw $66. So that motivated me to go to class every single day. I didn't want to miss a day because that was money I was paying from my pocket. So you need to concentrate in school and do just school. There will be plenty of time for everything else. It's like my dad says, you suffer now so you don't suffer later. And really just, you know, you are your biggest critic. Nobody has to come in here and convince you of what you need to do. You have to convince yourself how to do it and apply yourself, because actions speak louder than words. The average salary for a nurse, I'm going off my questions. The average salary of a nurse can be anywhere between $50,000 up to $120,000, depending on what your specialty is. Every time you get another a credential, another license, another something special that not every nurse can get, you kind of get a differential, I would say. But I want you to know that sometimes the salary differs because nurses are not staying stagnant. That means that we're not being content just being nurses. We want to research and look for the next best thing. In the Rio Grande Valley, I'm really passionate because there's not a lot of research on Hispanic population. It's more of like what is happening on the other side of the world and what are they doing about it. So nurses can participate in research as well as physicians to try to get all that information. We do a lot of evidence-based practice. Now, I know in school when I used to use this word, significant, it was just a fancy word for me to say significant. But here, when we do our practices, the way we test our skills is based on evidence-based practice. And that means to say that there's significant data reporting that this is the best way to handle a skills project. Significant means that you've done hundreds of studies, thousands, and you get the same results. So when you use the word significant, that means to say that you have a lot of same results that will back up what that study says. We are always back to the day of Florence Nightingale. We idolize her because when she first started taking care of the soldiers at war, in the Crimean War, she was the one that started not to keep the area clean, to wash things out. Otherwise, people were allowing their wounds to fester, and they weren't dying from the wound. They were dying from the infection of that the wound had been caused with all that dirt in there. And so she made a change. There's also it was a nurse who also thought about jaundice. We had an epidemic back in the 80s where babies were dying of jaundice. Jaundice, which we now know that with just a little sunlight, they can kind of let go of all that ugly color and get the baby back to normal, so they weren't dying anymore. I remember back, and it was not very long ago, when we had that Liberia went through the Ebola outbreak. I was one of the first nurses nominated by the infectious team disease to go help with the prevention, because we had a gentleman from, I believe it was Houston, that he came from Liberia to Houston. Now, if you think about it, how long does it take a flight to get here from Houston to the Rio Grande Valley? Maybe about 30, 45 minutes. So that's how much time we have to prepare for Ebola, because this man landed in Houston. So now viruses, they don't say, oh, you don't have insurance and you don't have insurance over there, right? A virus is a virus. It's going to go everywhere. So I got a lot of pushback when they say, why would you nominate yourself? Why would you go and try to be the nurses to receive patients if they get affected? Because if I don't help, or if I don't help, this is going to affect my daily life as well. Because maybe someone who's infected is going to go to school with my kids, or maybe I'm going to go to work with them at work, or vice versa. So it affects everybody. You know, I'm very passionate about being a nurse because I always put myself in my patient's shoes, and I follow Maya Angelou all the time. People forget what you say, and people forget what you do for them, but people will never forget how you make them feel. And that is not just in nursing, that is everyday life. You hang out with your friends because they make you feel good. People who have hurt your feelings, that don't make you feel good, you don't hang out with them anymore. So as a nurse, that's also important in the hospital, because we want to make sure that we not only take care of the medical, but we also take care of the emotional for our patient. Because if our patient feels good, they're going to heal better and participate in treatment. Okay? So there's other critical things that we deal with. Okay, here. What does a typical day look like for a nurse at DHR? Well, we get up early, okay? Yesterday I woke up early. I was here at work by 2 o'clock in the morning. So I usually go and I do my rounds on my unit just to make sure that I'm visiting with my night nurses. If there's any education, anything in the system, because it's always changing, I want to make sure that they're keeping up to the updates, because most of the time there's a lot of commotion that happens during the day, and sometimes at night I have the best opportunity to speak to my nurses, especially the night ones. But if I was on the floor in the morning, our day starts at 6 o'clock in the morning. We usually have anywhere, depending on what unit you are, I'm going to go with 6. So we have 6 patients. We meet with the night shift nurse because she's got to tell us what happened all night long while we were asleep. So at 6 in the morning, we start to get reports from the night nurse. This is patient 1, and this is what we're expecting. This is our plan of care. This is what we want to do. And so these are the medications they're taking. And then we jump to number 2. We find out what procedures are they going to, what doctors are on the case, what are we waiting for, when is this patient, can they go home, do they have a family member, who do we need to educate? Because we're not just educating the patient, we have to educate the caretaker who's actually taking care of the patient. So we want to find out all that information. At 8 o'clock, we start with our insulin administration because breakfast is coming. So we want to make sure that if anybody who is a diabetic, we want to make sure that we are giving them their insulin with their food tray. Okay. We also, right after our 8 o'clock medication, then we have breakfast time for them. And while they're doing breakfast, we're still giving out medications because there's 8 of them. Remember, 6 to 8 patients sometimes. Okay. So from there, usually by noon, the physicians start rolling in all morning long. So we could be doing, we are responsible for doing a report of everything that happened at night between 6 and 7 before the day shift nurse completely takes over. And in between, I mean, we can have one patient that has maybe 7 different consoles, 6 different consoles. Maybe they have a urologist, right, that deals with the patient's urinary tract. We can think about a renal physician who just does the kidneys, right? It's not the same thing. We can have a cardiologist. That's another person for the same patient. We can have a cardiac surgeon. That's another person. It could be a general surgeon. That's they're in different divisions of care. We can have a wound care doctor. We can have a nutritionist with diet because we want them to heal, so they have to be able to eat. We want to make sure that we're giving them enough fluids. We can also have an oncologist or hematologist or radiologist. And I'm ranting on, but sometimes these patients have so many issues because they have pre-existing comorbidities that one diagnosis will affect the other one. So it's just kind of like a ripple effect. A way that I can explain that, especially because there's a huge population here in the Valley that are diabetics. That's one of the things that you must educate yourself. What is the epidemic here in the Valley? And that is going to help you care for your patients. One of the things is, remember, we all have a pancreas, okay? The pancreas is responsible for releasing insulin into the body. When we eat, we're introducing sugars. So that capsule of sugar and that capsule with insulin, they combine and they convert energy. That's why we can function, we can work, we can do everything, feel good. Actually, after you eat, you get sleepy. It's not your fault. It's just that everything's shutting down so your GI system can break it down and metabolize it. But after that, it's like you get a spurt, like, oh, I'm not sleepy anymore, right? Because you just converted that energy. When your pancreas does not release insulin into the body, then the sugar will stay in the blood. And this is where we have problems with our diabetics, right? So they have to take oral medication so that they can activate that pancreas, so that way it can release the insulin into the body and grab those capsules of sugar, right? If that doesn't work, if the patient is non-compliant means they're not paying attention to the doctor or to their orders, then what happens is that they have to resort to insulin, because your body has to figure out how to convert that insulin and sugar into energy. Now remember, when you don't take care of your diabetes, it's a bad thing because sugar stays in the blood for a long time. When I start an IV, I can tell if the patient is a diabetic, because it'll just, when I'm trying to pierce it through, it'll just roll over because there's so much sugar around that little vein that I'm trying to poke. So it'll just move over. As well as the eyes, you'll see diabetics that have a lot of eye issues. It's because all that sugar is accumulating in the eye and it's increasing that pressure and it fogs up their vision. You'll see patients with leg problems. They feel like they're having, what do you call them, calambres. They're having shock rhythm. They're feeling like they just ran a marathon the day before because the nerves are trying to figure out and they want to shut off because of all that sugar. They get like cramps, right? Absolutely. And when those cramps stop, that's not a good thing. That just means the nerves shut off. You're not going to feel sensation. Then you have patients who don't take care of their feet, and then sometimes they lose them. All right, but the number one thing that causes problems with diabetes is renal failure, because that sugar also accumulates in the kidneys, our filtration system, and that is when the kidneys just shut down. Okay, I'm getting another question. Ooh, I love this one. Have I ever been in a situation where the patient was very combative, and how did I deal with that situation? I've gotten my hair pulled, yeah, but I do a nonviolent crisis intervention. So if someone were to pull my hair, okay, like this, the first thing you want to do is move away. That is the wrong thing to do. We teach to feed the pull, okay? So if this is the enemy's hand, I might have some of my colleagues pull my hair so I can do this appropriately. If they're pulling my hair, here, I got a volunteer to pull my hair. She's never going to get this opportunity again.
I've always wanted to do this.
So if she's holding my hair, my goal would be put my hand up here on top, so she can't grab any more than she already has in her hand. And then this hand, if you see the wristlet, it kind of goes like this. I put my hand down here and I just slide it off, right? You want to make sure you hold on to it so they're not pulling any more. Another combative situation. Now, when I teach this is not self-defense, okay? This is completely different. CPI is not self-defense. That's a totally different course, because we have to finish the shift. You can't go punch somebody and be like, oh, now I need to give you medicine. No, that's not going to be cool. But when someone is combative, we need to figure out, is this a family member that's being combative, or is this a patient that's being combative, and why are they combative? Because if it's a geriatric patient, that means a patient that's over 65 years old. I will have you know that my geriatric patients have a very good memory. And when they start to forget things, it's because they have an infection. So first, I look at the white blood cell count. That means those are your defenses. If your defenses are up in your body, you have a little infection. Most of the time when they're combative, they don't remember being mean. They don't remember doing that, right? So when they're combative, it depends. Is this as a result of a diagnosis? Children, when we give them anesthesia, they get really hyper. The geriatrics that go through surgery, they get combative because they're trying to get that anesthesia out of their system. They become forgetful, they hallucinate. But someone who combative can go into so many ways. Are they being verbally combative, or are they punching and screaming? Because we've taken care of patients who are handcuffed to the bed, okay, and we have a security that is there. Our primary job is to keep safe, yes, but if there was ever a situation where someone, and this goes for you all too in your school, of course you would have to, I don't want to speak out of mind, but when and if, heaven forbid, somebody shows up here with a gun, our nurses are not taught to run towards the gun. They are taught to keep their patient safe, run for safety, and call for help. We leave those situations for the professionals. The same thing with a knife. But if somebody is punching and holding, we have ways in this class that I'm telling you about is where we can hold and stabilize the patient and limit the range of motion. So legally it is a restraint, but we are keeping them safe from hurting us and themselves. And these are nurses, these are CNAs, these are medical professionals who have been trained on just how to hold the patient. Sometimes this is a last resort. I mean, it must have had to blow up if we're putting our hands on somebody. We don't like to do that. What we want to do is make sure we de-escalate the situation. Let me give you an example, and I hope I have some time. But I had a patient, I'm not going to give the name, but I had a patient, pastor, wonderful man, married to his wife, about to have their first baby boy. The wife comes in, she's having contractions, but we gave her fluids and then she was fine. Those were the fake ones. We call them Braxton and Hicks. So we just dismissed them and they were ready to go. The next time we saw this patient couple, the patient started to say, well, you know, it's not normal, she's bleeding. So we call that placenta previa. That means the baby is upside down and the placenta is in the way. So the patient in a really bad crisis could bleed to death and also lose baby, right? And so we didn't want that to happen. So we're telling the patient's husband that we need to take this patient to surgery right away, right now. Meanwhile, somebody in another area tells them, well, you have to fill out the paperwork. You just told this man his wife is going to surgery and you want him to sit down and do paperwork. It was just, he was not thinking, and he kind of wasn't trying to be combative. Let me tell you, he was a very nice man. But sometimes when you raise your arms and you accidentally hit somebody, that's when it can start to look like there's a rumble, right? All it took was for us to take this man back and have him gown up in his, the surgery outfit where they put the little paper scrubs. And the minute that he got the two little feet of the baby right here, he was a happy man. So that was brought down by de-escalating verbally and making him understand. But we have to understand what part of the crisis are we walking into, right? If someone is being defensive, questioning, who are you and what do you do here? And I want to talk to your supervisor. We have to give them a directive. That means when this happens, then we will do this. When this happens, then we will go, right? We'll go to the movies when you put on your seatbelt. You don't put on your seatbelt, we can't go to the movies. So you give people the choice. That's how we want to avoid any being combative with anyone. We give them a choice. When you start taking people's choices away, they start to refuse to do things, right? So you tell them, you can do this one or you can do this one. But it's not gonna, there's no white or gray, black. White or black, no gray. So which one do you want, right? And this is even for us, we agree to disagree. We didn't agree with the results, but we're agreeing to do it because that's the best thing to come. And sometimes, guys, and you're gonna hear this over and over in your career, communication. You need to make sure that you're able to communicate your ideas well. That is definitely something you need to practice, because a lot of the issues that we have, well, not that we have, but that people have in transitioning, is that you cannot document on a patient's medical record the way you speak to your friends. You have to be very professional, right? And document appropriately. That is a huge thing. If you're in nursing school, if you didn't document it, it never happened. You can say, well, I usually do this, but you didn't document it, right? We also have to be careful on how we say things, right? With this combative situation, how was the patient combative? Was he acting out aggressively or was he being violent? Because if you are in a court of law and you say that the patient was aggressive and violent, aggressive means to say your behavior, you're talking through your teeth, you're really upset, you're aggressively holding things or taking things away from people, that's aggressive. When you accuse someone of being violent, that means they're willing to hurt you, throw a chair, they're throwing things at you, it's getting more physical. So if you're trying to describe one and you use the wrong word, your testament is no longer good. So it's really important. I also want to say, guys, I have a friend who did nursing school and just said it wasn't for them anymore. And they went to law school, and now one of my friends is a nurse attorney. Isn't that awesome? So now they get to defend, medical people because they know the field. So I don't want you guys to think that nursing is just nursing. There's so many things that you can do with a nursing license. With a nursing license, you can work in the OR. With a nursing license, you can work with kids at pediatrics. With a nursing, you can work home health. You go see patients at their house. There's a wide variety. You get tired of doing too many of this, you can switch it up, and you're still a nurse, but you're doing a different type of nursing. So that's really important to know. One of my long-term goals is to be a flight nurse. So I'm actually training my physical body so that I can be able to handle that high pressure. My family's from Colorado, so whenever I go to the Rocky Mountains, I get nosebleeds. So that's something that I'm working on because that's my dream. I'll be the happiest nurse ever if I get to do flight nursing, even if it's for a couple of years and not a lot of years. Do you all have any other questions? Anything you all are curious other than salary?
We have about 10 minutes left, so if anybody has any questions or any pressing comments, please type it in or come to the mic and unmute yourself. It's been so informative. Thank you. Anyone?
I just want to make sure and say, guys, when you come to the hospital, if you're a senior or you're going to be a senior, I train my students like they were my nurses. So don't be shy. Ask questions. Don't feel offended if you're asking questions at the wrong time. They'll make time for you. They just have to see that you're willing. Don't stand with your hands, kind of like this, like you don't want to touch anything, or behind your back. When you're on the nursing medical floor, you need to be interactive. I'm getting another question. How long does it take to be a CRNA, and what type of education? So I'm not familiar with the CRNAs, but from my colleagues that have gone to CRNA school that were already nurses, so it takes you 2 years to be an RN, and it may take you another 2 or 3 years to be a CRNA. And so what they've done is well, my girlfriend in particular, she went, I believe, to Arizona for a year, and then she came back. And I believe, and I'm not really sure, but I know that our hospital has an affiliation with a CRNA school. So they do their clinicals here in the hospital, and then they do part of their curriculum with their professor. Just like we're Skyping, they Skype too every Thursday. And I think that goes on for semesters. For pediatrics, primarily, guys, once you become a nurse that you come into the hospital, I highly encourage you to do the nursing residency program. In this program, in the past, I know that they say, okay, what are the top 3 units that interest you? Well, I like pediatrics, I like OR, and I like ER. So they'll take you to those departments, they'll split you up, and they say, okay, where do you want to stay, right? There is specializing in pediatrics as a pediatric nurse. And actually, there's specialties in every part of the unit. So pediatrics has their own critical care pediatric nurse. The one that is in high demand right now is giving chemotherapy to pediatric patients that have cancer. So that is also important. There's different specialties that you can use that are accredited by the state that you can take, kind of like a board exam. Just to say that you are a critical care in a pediatric, you're a critical care for neurology, you're a critical care nurse for ICU. So there's critical care nursing for everything, and that is also, you have to take like a class, and then you study for it, and then you have to have, of course, I believe the minimum is 2 years before you can do any specialties in pediatric nursing. So if pediatric nursing is what interests you, you can do 2 years in pediatrics, and then you can apply with the state for that critical care nursing certification. No, the state board tests for all nurses are the same. Every nurse takes, it's kind of like having a driver's license, right? I don't know if you all have driver's license, but when you get it, there's no specialty. You have to know how to drive the road the same way. So that is the way that nurses. It's the same Texas State Board of Nursing. How you specialize, that's up to you. Where can they get the information for the volunteering? Here? They call it
DHR Volunteer Services.
So call DHR Volunteer Services if that's something that you are interested in. What's the number? Let me get the number for you. I'm making sure I'm going over all the questions. Okay, so for, so they're telling me volunteer services. I'm trying to get you the number, or I can type it in and maybe we can get it if our time is up. So it's 362 3203. 362-3203 is a number. So if you're interested, make sure you start making those calls. And that would be a great, keen insight. I started with feeding the babies in the nursery. That was so much fun. Do we have any other questions? Are you all excited about being nurses now? Let me stop the video. Let me see. Hello, can you guys hear me?
Are you there, Nurse Clarissa?
Hello, can you hear me?
Yes, we can hear you now. Okay, so
Okay.
we have about 4 minutes left. So if you have any more questions or you want to give us some closing advice or anything on students interested in nursing, you can do that.
Well, definitely look up the HESI, guys, if you're interested in nursing. It's really hard to, unless you're seniors and in school already, then start looking at those HESI if you are looking into going into nursing school. Also, start looking for American Heart. I know that most universities prefer American Heart BLS certification as you're going to nursing school. Make sure that you ask for your immunization card, okay, because your high school should have it for you. But that is a huge ordeal when you're getting a nursing job or you're doing volunteer services. Make sure you have a copy of the most current vaccinations because they will ask you to redo them if you don't have them in line. Don't lose them. I know some of you guys have them like split in little papers. They probably have 10 pieces to it, but make sure you have a good copy of that. Just early enrollment, start applying for financial aid. If you're a senior right now, start applying. You're kind of late already. If you're a junior, you start applying for financial aid in November, December, the latest, because they start to distribute all those monies. Apply for scholarships, okay? It's never too late. Look for scholarships here in the Rio Grande Valley. I know that LNF Distributors offers one. It's called STARS, S-T-A-R-S. You can look into that. And make sure you start networking. If you're going to volunteer, start talking to nurses and ask them how did they get here and what did they do and what's easier for them. When you start to network with people, you kind of attain your goals a little bit much faster, right? It's easy not to know. And make sure you gain some customer service experience. You know, we have to work with diverse populations. You know, the best way is to get some working experience and kind of develop those interpersonal skills necessary that are going to be needed, you know, as a nurse working in the nursing field, talking with people. So if you're shy, you know, you have to kind of find a way on how you're going to be able to communicate your ideas to others. Okay. And also, you know, I believe it's the TEAs. Start looking at that. It's the test of essential academic skills. So when you're taking exams, guys, I want to tell you, it's not that you don't know the information. It's just that you are not used to being asked questions several times. So if you're not used to taking 170 question tests, you're probably not going to do well, because after question 20, you're just tired of questions. So always think when you're taking a test, you answer the question, move on to the next one. Stop thinking about the one that you might have gotten wrong, because that's when your brain starts to feel scattered. So practice test taking questions. Practice taking 20 questions a day, then 25 questions a day, then 30 questions a day, and keep building your tolerance. You know, exercise that brain every single day for whatever subject that you're studying for. That always helps. Repetition helps you make you better. Okay? Can you see me now?
Yes. Thank you so much for all your advice. Yeah, we could hear you for a while there. It was just black, but we could still hear you. Thank you so much for sharing all your expertise and your experiences with our students. We are out of time, so again, we're grateful that you were willing to give us all that information.
Thank you for having me. I barely made it. I was running in from the floor, but thank you so much for having me. I hope I was a help, and I hope you all have a great day.
Yes, thank you. Goodbye.
You're welcome. Bye.